Sustained effect of resistance training on blood pressure and hand grip strength following a detraining period in elderly hypertensive women. Increased endothelial dysfunction and increased arterial stiffness contribute to an increased prevalence of hypertension among the elderly, particularly systolic hypertension. Exercise has been shown to be an effective treatment in older women with hypertension. A period of training cessation will likely occur in those who train on a regular basis. Previous findings have shown strength above baseline could be maintained in older adults anywhere from 12 to 48 weeks from the onset of training, which is a pretty wide gap. In previous research, blood pressure changes were only maintained for 4 weeks in hypertensive middle-aged men following detraining. At the time of publication, no previous studies had examined the effects of detraining on hypertension and strength in older adult women. The purpose of this study was to determine what effects a 14-week moderate-intensity resistance training program would have on blood pressure and muscular strength during an extended detraining period in elderly hypertensive sedentary women. 12 elderly women over the age of 60 were chosen based on not having participated in exercise training for the last 6 months. They also must have been stage 1 hypertensive. Participants were excluded for having a history of smoking, cardiac arrhythmia, arterial coronary artery disease, stroke, congestive heart disease, or physical disabilities. Participants were assessed for hand grip strength with a hand dynamometer and blood pressure with an automated cuff. No dietary tracking or advice was given. Resistance training consisted of 2 sessions per week of 3 sets of 8 to 12 repetitions of moderate intensity exercise for 14 weeks. Intensity was based on an RPE scale. Intensity remained consistent with increased tolerance to training, so the amount of weight used throughout the training may have increased, but the researchers ensured the rate of perceived exertion remained constant. Machines used for training included seated bench press, rotary cuff, leg extension, leg curl, leg press, and front lat pull down. The rest intervals between sets and exercises were 2 minutes. Reassessment occurred after 14 weeks of training. While there's no video to show what the resistance training program looked like in the study, we can imagine it looked somewhat like this. It's my life, it's now or never, 'cause I ain't gonna live forever. After 14 weeks of training, systolic and mean blood pressure decreased significantly when compared to pre-training values. Relative hand grip strength increased from resistance training when compared to pre-training measurements. Following the 14 weeks of detraining, absolute hand grip strength remained 6% higher than pre-training values and remained significantly elevated. When weight was taken into account, relative hand grip strength was elevated compared to pre-training, but not significantly. Diastolic blood pressure remained 13% lower when compared to pre-training, but was not considered significant. Systolic blood pressure and mean blood pressure remained significantly lower than pre-training values. The results showed that following 14 weeks of detraining, elderly hypertensive women are still able to maintain the benefits on blood pressure and hand grip strength. Potential causes for the blood pressure changes would be sustained reduction in peripheral resistance, a release of vasoactive factors, or a greater increase in physical activity independent of the resistance training program. Further research should be done with a control group or with restriction on salt and fluid intake, which may have affected results.